The specific silicone implant we will use for your breast augmentation surgery will be determined based on your physical examination findings and your personal desires. We'll decide it together. Your examination findings might be suitable for a type A or type B silicone implant, for example. However, your preference might be to use a type C silicone implant. As I mentioned, we will certainly listen to your wishes, but you must also know that your examination findings are equally important. I want to tell you about silicone implants. Silicone, or rather silicone, is one of the inert materials that the body accepts. In other words, the body is one of the materials that does not cause much reaction and is easily accepted. Silicone implants are categorized into two main types, those filled with saline and those filled with silicone gel. Gel-filled silicone implants can be further classified according to whether their outer surfaces are smooth or textured or based on their anatomical or round shapes. Can also be classified within themselves. Anatomical implants are what people commonly refer to as teardrop-shaped implants. We must be very clear about this point. Are these silicones or these types superior to each other? The important thing is this: whatever implant we use, no matter the type or kind, what matters is the patient's physical exam findings. If we carefully select the most appropriate silicone implant based on the patient's physical examination findings, there is absolutely no obstacle to achieving a truly superb result. That means, of course, for implants, both textured surface implants and smooth surface implants have their own inherent advantages. Up until about 4 or 5 years ago, the silicone contained within these gel-filled implants was of a fluid consistency. However, thanks to recent advancements, the silicone material inside these gel-filled implants is now being produced in a non-fluid cohesive state. That is, it is called cohesive. Because they are prepared with a non-fluid consistency, they have become significantly more reliable. Another option for silicone implants is the saline-filled type, which we prefer for patients who want to avoid visible scars. We prefer it for patients where we will use the armpit technique or place the implant through the belly button. We insert this implant while it is empty. Once it is in place, we inflate the silicone implant using saline injected through a small tube. Thus, it is a material that our body accepts under any circumstances. And the best benefit for us is that the surgery can be completely scarless. Consequently, among these various silicone implant options, we must always select the one most appropriate for your physical examination findings. We must pick. So please do not come thinking of a specific implant type in your head. Don't come with a fixed decision. Of course, your wishes are very important to us, but I want you to know that your physical exam findings are also important. A question we are frequently asked is whether silicone implants can explode. Ladies and gentlemen, silicone implants do not explode. They do not explode on their own, or by bumping into a door, or hitting a wall, or from the contact that may occur during your sexual life. They do not explode from contacts. In order for them to rupture, there would need to be an injury caused by a sharp or piercing instrument. For instance, if you were to take a small pin and puncture a silicone implant, if I were holding one, yes, the implant would be punctured. You could consider that an explosion. However, on their own, or as I mentioned, due to simple impacts, with simple traumas or contacts in your sex life, you cannot make silicone implants explode. Especially in recent years. With silicone implants, you can even use these silicone implants for a lifetime. In recent years, we have been facing many questions due to a French origin implant brand. We are frequently asked questions such as, Doctor, do these implants cause cancer? Concerning the brand of the prostheses. Ladies and gentlemen, it has been proven through scientific publications that silicone implants do not cause breast cancer. Regarding the issue that occurred about 2 years ago due to problems in the manufacturing of that specific silicone implant, low quality, and because low quality silicones that should not have been used were used, these types of problems were encountered all over the world. However, it is a silicone implant that is used very rarely, especially in Turkey. I have never used it in my own professional career. Our current implants are high quality. They don't stop breastfeeding, having a baby, or anything like that. At the same time, they do not cause breast cancer and they do not explode on their own. And even, I mostly tell my patients that if there is no problem, these silicone implants do not need to be replaced. In short, there are different implant types. Among these different types, we will choose the appropriate silicone implant according to your exam findings and wishes. Please be aware that silicone implants do not explode, and please consult with us for a perfect result.